So in this episode, we are going to be talking all about knee pain, more specifically knee pain whenever you're running. And this is actually going to be a part of a 3-part series with regards to knee pain and running. And in this part, I want to be talking about the one thing that you've probably never been told that can change everything when it comes to your knee pain. So generally when I see runners with knee pain, it's really, really frustrating because it's one of those things that sometimes you feel like you could push through. Other times it doesn't feel like you could push through it. It feels very sharp and feels like you have to stop. And it can be really tricky to know what to do. And I sort of see 3 main problems whenever runners have knee pain. And the first problem with that is this misinformation and this mixed information, not really being sure what's specific for you. Should I rest? How much rest is too much? Is trail running okay? Is road running okay? Hills, tempo runs, interval runs, long runs. It's very, very hard to know exactly what you should be doing and how to manage that training load. So that's a huge problem that I'll see. There's a lot of trends, there's a lot of fads out there, and that sort of leads to sort of non-specific advice and non-specific rehab. The second thing I see, which is frustrating when it comes to knee pain in runners, is the use of knee braces and knee straps and taping as well. And it can be tricky because this can provide you that short-term relief, which can be really helpful if like it's just before a race or something like that. But it can give you sort of this false sense of security that the knee's okay, and then you take the knee strap off, or you try to run without it, or you change the knee strap, and suddenly the knee pain comes back. So it can lead us into that false sense of security when it comes to knee pain, which can be really frustrating as well, because it gets us into that cycle of injury, recovery, and re-injury. And then the third thing is that I find, which is sort of what I'm talking about today, is that knees often get the blame, whenever actually there could be something else causing the problem. And a lot of the time you'll go to your physio, you go to sort of your sports therapist, and they'll say, yes, that knee is X, Y, and Z. That knee is damaged in this way, and you need to do this for your knee. And the knee gets a lot of the blame, which can't be sometimes isn't helpful because there's often other things going on, which is exactly what I want to talk about today. So I'm going to bring something up on the screen. You will see this. This is what we like to call the 20% rule, and this will hopefully be the one big thing that you haven't been told, which will change everything, especially change the lens in which you view your knee pain if you're a runner. So up on the screen here, you will see 2 legs. If you're listening to this and not watching this, you're not missing out much. These don't look like very, very good legs, but hopefully you'll understand what I'm talking about here. Up here, we have your back, then we have your bum, then we have your knee, and then we have your foot. And this is a leg running in this direction, okay? So it's running to the right. And when we run, obviously our foot strikes the ground. And when our foot strikes the ground, people would say that it's 2 to 3 times our body weight in force going up into the body. First of all, absorbed by the foot, the Achilles tendon, all of those structures, and then it sends that force up into the body, and our body has to decide, right, what am I going to do with this force? And generally that is run in a straight line and keep going. So when we are dealing with knee pain, quite often this force transmission can be a little bit altered, and that's what I really want to delve into here. So when your foot does strike the ground and there's 2 to 3 times your body weight of force going up into the lower limb, we want that load to be equally distributed. We want everything doing its job so that nothing's unhappy. So in this situation, we would be saying that this foot needs to be doing about 20% of the work. We'd say the knee needs to do about 20% of the work. Hip needs to be doing about 20% of the work. Hip muscles sort of around your like glute area would need to be doing 20% of the work. And then that posterior chain, so hamstring and calf complex, need to be doing about 20% of the work. This is a really happy leg. This person's gliding. Those people you see sometimes in park runs and they're like floating past you and you think they look like they're putting no effort in and you're trudging behind them. That's exactly, they've got a really good 20% rule. They're probably floating because they've got this lovely sort of ability to communicate between their muscles, and it's all very efficient. They have a very efficient running pattern. Over here on the other side, what I'm going to draw is a bit of a mismatch of this loading, which we can see quite commonly with people with knee pain. So let's say, for example, this person on the right, if I say this is the person on the left and this is the person on the right, the person on the right maybe has had an old ankle injury, and we're talking years ago, but they've never really felt 100% confident in that ankle again. So I'm going to mark it down to 10%, okay? So it's not quite doing its job. Maybe then as a result of having an old ankle injury, they've got poor intent through their foot and they struggle to fire up the muscles into the posterior chain, because if we have poor intent through our foot, we can't quite get our calf switched on, see them up into the hamstring, that posterior chain can get a little bit weak. So if we say that it's going down and it's only doing 10%, maybe they've been told before that their glutes are a bit weak and they have like maybe a bit of instability around their hips. Maybe that's an old injury, maybe that's a movement pattern thing. Maybe their hip joint itself is completely fine, it's doing its 20%. As you can see already, these numbers aren't starting to add up to 100, okay? And what we're seeing here is that there's a gap. This foot isn't quite doing its job, and therefore it's lacking 10%. The posterior chain isn't quite doing its job, it's lacking 10%. And the lateral hip muscles or your glute stability muscles aren't quite doing their job, and it's sitting around 10%, so it's lacking 10% away as well. If we add up, that's an excess load of 30%, but our body is very, very smart. It doesn't just spit that load back out again, it generally compensates. And this is where you hear this word quite a lot, that a certain muscle or joint or tissue is compensating. And for a lot of time with runners with knee pain, what we will find is that their knee is picking up that excess load. It's picking up that excess slack. There's excess load going through that joint and it's having to absorb it. And it's doing a really good job. It's trying to fit its very best, because every single time you take a step, and every single time that 2 to 3 times your body weight goes up into the body in force, that knee is doing 50% of the work, which, as I'm sure you're very aware, is not what we want. Because over time then structures maybe start to get injured, start to get irritated, or maybe the brain just simply starts to send out signals saying, I don't feel safe, can you please stop? And pain signals start to get sent to the body. Maybe there's a feeling of tightness around that knee. Maybe if you've had an old injury before, the same sort of symptoms start to creep back, and the knee generally gets a bit grumbly and a bit irritated and a bit unhappy. And whilst you might have been told something like this before for your knee pain, where I see a lot of people going wrong is that they really fixate and focus on that area. So the knee is doing too much work. They start to think, okay, that knee's overloaded, that knee is injured, what can we do for that knee? And they start to give out things like single leg squats and our lunges and our squats and telling us that we need to strengthen our knees, and we put so much attention on the knee itself. But the problem with doing that is you're putting so much attention on the area that already has too much attention. And as a result, it just keeps getting caught into this cycle of injury and re-injury. In reality, very simply, what we need to do is look at the wider picture, take into account our injury history, take into account our weaknesses and our strength tests, and actually start to build up those other areas. So in this situation, we'd be looking at doing some foot and ankle work to build up the strength in that foot. We'd then be trying to build up that posterior chain and make it a little bit stronger, and then building up the hip stability muscles and get those hips moving well and get those stability muscles operating well for running. As a result of building these three things back up to 20%, then we're going to find that the brain and the body will start to adjust, the compensation will start to unravel, and that 50% will go back down to 20%, and you'll have a much happier knee. And the goal is to get yourself looking like this diagram on the left, where everything is doing its job, nothing is overcompensating, and you've got a very happy knee when you're running. And this is exactly what happened to our client Justin. He hurt his knee whenever he was running, and he got to the stage where he found that he couldn't run any more than 10 minutes, or any time that he increased the pace, his knee would start to tell him, I'm sore, can you please stop? And he had tried different things, he had tried his stretches, he had tried his exercises, and nothing was really helping, nothing was giving him the relief that he needed. When we assessed Justin, we found out that multiple old ankle injuries were leading to him having poor intent through his foot. He wasn't absorbing force very well, that force transmission up into the rest of the lower limb was quite poor because of an inability in and around his foot, as well as him having multiple hip flexor and groin issues in the past. Justin came to us at the end of December, and his goal was to do a high rocks pain-free in March. Was he able to do it? Yes. Did he stop there? No. In just a matter of weeks, Justin is actually running his first ever half marathon. And throughout his high rocks training, throughout his high rocks event, after the high rocks event, and even through this half marathon training, he has experienced little to no knee pain. And how did we do this? Well, exactly what I was sharing with you before. We focused on the other areas surrounding his knee, not just his knee itself. Did this mean that we did no knee exercises whatsoever? Of course we did. We did loads of knee exercises. Think of high rocks, lunges, wall balls, all of those things. His knee needed to be prepared for the load demands that it was about to go through. However, there were a few massive gaps missing in his current exercise program to do with his foot and to do with his hip that needed addressed first. So what do I want you to take away from this episode? Well, I want you to consider your old injuries, and I want you to consider the areas above and below your knee joint. Think of things like your foot and your calf. Think of things like your hamstring, your glute, and your hip. And ask yourself, are you including these in your current training plan? If the answer is no, you could be putting yourself at risk of a knee injury, or you could be inhibiting yourself from getting out of a knee injury. So I'd really recommend having a nice, varied, well-rounded exercise plan that is strengthening up those areas, offloading the knee, and then you can start to introduce a little bit of your knee strengthening.